Sharon Hanley from Hanley Consulting and Managing Director. We formed in 2009. We're currently based in Tring in Hertfordshire, and we've been working in primary care for the past 20 odd years.
My name is Max Gatlin. I'm Sharon's son. I joined the business in 2020. 3 months into the COVID pandemic, there was a rush to deploy digital booking platforms for people to get their vaccines, and I joined to help and support with the deployment of those technologies. And eventually we grew that, and those projects snowballed into supporting with cloud telephony, online consultation tools, and all kind of digital tools which are in primary care at the moment.
Hanley Consulting is very much involved in all levels of the spread across the NHS, looking at how we can help them use their tech to better manage and be more resourceful as well, and sort of saving time. We very much believe that the benefit to all of this tech is at scale. So when NHS England brought in primary care networks, the whole ethos around that is to work at scale, reduce cost, improve impact. And so we very much run along those lines.
I mean, our strapline is improving healthcare through technology. So the mission of the company is to enable these healthcare organisations to deliver better care through more efficient use of their tools. If we can leverage technology and free up their time, they can spend more time delivering care direct to patients. Zoho CRM is central to our daily operations as a company because it's got such amazing lengths of customization that you can go to. And because of the structure of the NHS, we've been able to actually build in child and parent organisations so that the practices can sit within PCNs and the PCNs can sit within the federations and so on. Things like patient population are huge in primary care. So if a general practice has, for example, 10,000 and there's 5 of those practices within that PCN, the PCN field is auto-populated with 50,000 patient list size, and that helps us with managing our clients in a much more efficient way. Another big benefit of Zoho CRM is that you can have unique identifiers. So in primary care and in the NHS in general, every organisation has an ODS code, and we've set that as a unique identifier. So we can map any fields from other apps like forms and surveys, and we can populate those fields based on that ODS code. So nothing is overwritten, no new records are created, and we can configure it so that those contacts are added to that one specific organisation. We drive leads from our website predominantly. So we have Zoho forms embedded on our website, and on those Zoho forms we've mapped the fields to suit the Zoho CRM. So if a lead fills out a form on, whether it be on the website or on social media, we gather leads from LinkedIn as well. And what that'll do is auto-populate the organisation in the CRM with the contact details. And what we can actually do is we've triggered it so that will create a deal in Zoho CRM as well. And that allows me as a sales manager to manage the process of how we convert those leads into clients. So Zoho CRM is brilliant and very easy to use. We've got the deals module set up in a Kanban view. So we have a sliding scale, a 10-part process of the sales process, going from new lead right through to closed won or closed lost. And actually we've built in a solution because we have a percentage probability at each stage, and also the estimated revenue from each deal. We can work out a calculated revenue forecast to support us with our financial planning as well. There's over 6,500 GP practices in the country. We want to work with every single one of them, but what we have is every different practice could have a different set of technologies. They could use a different telephony provider, a different online consultation user. So what we've done is actually embedded an onboarding form. When we onboard new clients to deliver services to, we ask them those simple questions to identify what technologies they're using to allow us to better help them. And from that, we actually gain more insight from them in a simple form completion than we would if we'd had 5, 6 or 7 meetings with them to discuss their tech stack. And those fields from the form are again mapped straight into Zoho CRM, and we've developed those fields in the CRM so that each organisation is auto-populated with their telephony provider, which online consultation that they use, and we've even now gone one further. We've embedded the ability to capture POMI data as well as GP patient survey data straight back into the CRM, and we can group that and helps us target and better support our clients. Another really helpful feature of Zoho CRM is the role-based access. So we work with multiple contractors and clients that need access to some of our data in order to work and collaborate better. We have an outside contractor that manages all of the social media. We're able to give her access so she can come in and do her work in a siloed manner and doesn't have access to all of our other data. Another example is we're working with a health tech company and we're actually supporting them with their sales process. So we can give them access to an individual sales board which has all of the deal stages, and we can collaboratively work on that so that when we meet weekly, we can have a good oversight and an understanding of where we are in each process, and that will help them forecast as well. Completely confident when I'm allocating or giving this access to third parties. You can go so granular to actually close off even modules within the apps. So for example, in Zoho CRM, you may have tasks and deals, and I could just trigger that third party could only view the deals and not all of the tasks that we have to do.